Good morning, welcome to Breakfast with Charlie State and Naga Manchetti.
Our headlines today: tougher national COVID rules are discussed by the Prime Minister after scientific advisers warn him of a significant rise in the death rate.
Options include closing parts of the hospitality sector and limiting pub opening hours.
2 million people in the northeast of England come under new local regulations from today. Similar rules could now be enforced in Lancashire.
Good morning. The Welsh wizard is returning. Gareth Bale is set to complete his move back to Tottenham later today.
Good morning. I'm at RHS Garden Wisley this morning, where we're talking autumn bulb planting. It's a dry start to the day here, and many of us should see a dry, fine day ahead. I'll have more details in about 10 minutes.
Good morning, it's Friday the 18th of September. Our top story today: tighter national restrictions across the whole of England are being discussed by Downing Street to try and slow the surging number of coronavirus cases.
The measures, which are being described as a circuit break, have been raised after a warning from the government's chief scientific advisers that there would be a significant rise in the death rate without further intervention. Simon Jones has more.
This is what Boris Johnson is desperate to avoid: another full-scale national lockdown, which he says would be a disaster for the economy. Instead, the government could introduce what's being called a circuit break, perhaps just for a fortnight, of tightened restrictions in England. Schools would remain open, as would workplaces, but pubs and restaurants could have their opening hours cut. Some public premises would have to close. No final decisions have been taken, as the government waits to see the effect of the new rule of 6. Nearly 10 million people are living under stricter restrictions already. At midnight, people in large parts of the northeast of England were told they could no longer socialise with those outside their own household or support bubble.
Why take notice of these new rules when they didn't take notice of the other rules?
They keep changing them all the time, so you don't know what you're doing when you come out.
It's better than across the board. If we can try and do it where it is, it might stop it spreading.
Lancashire, with the exception of Blackpool, is expected to be the next area to face local restrictions, with similar controls to the northeast on socialising and a 10 p.m. closing time for pubs and restaurants. But criticism remains of the testing system. There was frustration in Sunderland yesterday when people turned up at this site to find no sign of any testing.
Ministers didn't increase testing to the levels that were needed. So it's not world-beating, it's a shambles.
I wouldn't sit here and claim that this is,
World-beating.
Absolutely going, exactly as I would hope it to go, but we are constantly improving.
In the latest 24-hour period, 3,395 new coronavirus infections were recorded. That's slightly higher than the average for the past week. And with the Prime Minister warned by his advisers that there could be a significant number of deaths by the end of October without further interventions, there are some tough decisions ahead. Simon Jones, BBC News.
Well, let's talk now to our political correspondent, Jessica Parker. Morning to you, Jessica. So what we have here is a clear warning from scientists, a discussion at Downing Street, and a new phrase, circuit break. What's the significance?
Yeah, a circuit break, the idea, I guess, being to try and really pause things, stop the virus from spreading too much, but not going for that full national lockdown to halt it altogether. The Prime Minister has this week described the idea of that on the economy as potentially disastrous. I think the government really eager to avoid that at all costs. But it's interesting because I think if you look at what's happened over recent months, and when the government talked about a whack-a-mole strategy, finding out where there were local outbreaks, tackling them locally, well, actually, increasingly, those local restrictions have become rather regional. Swathes of the country, millions of people under some kind of restriction, which I think naturally raised the question as well as to whether at some point this could become nationwide across England. And while no decisions yet made, it certainly seems that there's deep concern within the government. They're monitoring the situation, waiting to see, as Simon was reporting, what impact the new rule of 6 will have had. But of course, that was a simpler, a blunter message, and perhaps going forward in terms of restrictions, we could see a simpler, blunt approach again as well.
Yes, and we've seen, of course, across a large area of the northeast, those restrictions coming into play already, but questions as to where next.
Yeah, so an area next we think is for local lockdown for people living in Lancashire, with the exception of Blackpool. That comes, of course, after restrictions have been applied across large areas of the northeast. We don't yet have exact details as to exactly what will happen in Lancashire. There's some sort of announcement that is expected imminently. The Department of Health are not yet commenting, but again, a further sign that there is concern locally and nationally about the spread of the virus.
Jessica, thanks very much.
Now, as Jessica mentioned there, new rules came into force across most of the northeast of England overnight. Our reporter Olivia Richwald is in Sunderland for us this morning. Olivia, morning to you. I can see it's a rather dusky morning. The nights are setting in, aren't they? Or the mornings are becoming later. But, however, this is a new dawn, so to speak.
Well, that's right. It's a very foggy morning here in Sunderland, and as people wake up this morning, 2 million people across the northeast of England are waking up to new restrictions. And those restrictions will have a big impact on people's lives because they can no longer meet up with family and friends in their homes or gardens. And nightlife here will stop at 10 o'clock. Here in Sunderland, the number of positive cases per 100,000 of the population is now more than 100. And that is worrying local authorities. But it's not just that figure that's worrying them. There's also been an increase in the number of positive cases in hospitals and an increase in the proportion of people testing positive. And it was that trio of worrying factors which led to 7 local authorities here in the north east of England urging the government to impose these restrictions. Now, the restrictions include not being able to meet up with family and friends in the gardens, restaurants and pubs having to close at 10 o'clock, and people are being asked to avoid using public transport unless it's for essential travel. And everyone from rural Northumberland and County Durham to the urban areas of Newcastle and Sunderland are affected. The message from the local authorities here is please do adhere to these guidelines if we are to continue in the way we've been going, with children able to attend school and people able to go back to work. These restrictions have been described as temporary, but there is no guidance as to when they might end. But they do come as the big universities in Newcastle, Sunderland and Durham get ready to welcome students back.
It's interesting times. OK, Olivia, thank you so much. Olivia Richwald there for us in Sunderland.
Care homes in England are to receive extra funding of more than £500 million to help them control coronavirus infections over the winter. The money will be used to provide free personal protective equipment until March and ensure workers are still paid if they need to take time off to self-isolate. Care directors have welcomed the initiative but have said it does not address the need to pay staff better.
Scientists say a rapid coronavirus test has been developed that can accurately diagnose an infection within 90 minutes without needing a specialist laboratory. The device is already being used in 8 NHS hospitals. The government has ordered more. It's most useful for helping to quickly identify people with COVID-19 in hospitals rather than mass testing.
The number of confirmed coronavirus cases around the world has now risen beyond 30 million. More than 940,000 people have died with COVID-19 since the outbreak began in China. That's according to figures from Johns Hopkins University. The worst hit nations are the US, India and Brazil, though infection rates across Europe are rising rapidly.
Israel will today become the first country to return to a nationwide lockdown. This is after a surge of new cases.
Closure, which begins this afternoon, will last for 3 weeks and comes at the start of the Jewish New Year. Yolande Nell has this report.
Getting ready for the Jewish New Year and a new lockdown. Crowded ultra-Orthodox neighbourhoods in Israel are among the hotspots where COVID cases have jumped, pushing the infection rate up to one of the highest in the world. Synagogues are at the heart of religious communities.
We're only allowed to have sometimes 10, sometimes 20, depending on the regulations.
But strict rules now mean few can gather inside.
It's a remarkable time of the year, the most exceptional time of the year in the Jewish calendar, and people are not going to be able to pray in their usual prayer areas, in their synagogues. They won't be able to be with family.
Stay at home is again the message here. But the new lockdown to deal with the public health emergency is only going to deepen Israel's economic crisis. Unemployment is at a record high. Many businesses are failing, leading to mounting criticism of the government.
In this closure, I hope they're going to end this story once for all.
This new mother, who's already lost her job, doesn't believe it will.
gonna be worse than now. It didn't work in the first time. It's not gonna work in the second time.
When Israel's tight controls quickly curbed the first wave of COVID-19 earlier this year, it was seen as setting a world example. Now, as it's forced into another painful shutdown, many other countries will be hoping to avoid following its lead. Yolande Nell, BBC News, Jerusalem.
This is Strictly the best of movies.
Our incredible Strictly pros and judges will help us reminisce.
Here we go. Lights, camera, action. Strictly the best of movies. Saturday at 7:30 on BBC One and iPlayer.
Good morning, you're watching Breakfast with Charlie State and Naga Manchetti.
As we've been hearing this morning, the government could enforce tighter national restrictions across the whole of England to try to stem the rising number of coronavirus cases.
The Prime Minister was warned by advisers that there could be a significant number of deaths by the end of next month. Let's talk to the Health Secretary, Matt Hancock. Matt Hancock, thanks very much for joining us this morning. Good morning to you.
Good morning.
Morning. This is very worrying, isn't it, that we could see a significant number of deaths by the end of October if there are no further interventions, and advice from the chief scientific advisors saying that perhaps a circuit break, almost a version of national lockdown, is needed. What's the plan now?
Well, we have seen an acceleration in the number of cases over the last couple of weeks, and we've also sadly seen that the number of people hospitalised with coronavirus is doubling about every 8 days. So we do need to take action. Yesterday I took action in the northeast, working with the councils there, where there has been a very sharp rise. And obviously we've brought in this week the rule of 6. It is absolutely critical that people follow these rules, follow the rule of 6, follow local restrictions if you have them in your area, and also that if people have tested positive, or if people have been in close contact with somebody who tests positive, that they self-isolate. And if we do all these things, then we can avoid having to take serious further measures. A further national lockdown is the last line of defence. You know, the first line of defence is all of us doing hands, face and space and the basics, getting a test if you have symptoms, not coming forward for a test if you don't have symptoms, but instead doing the self-isolation if you've been requested to. So, you know, we all know the rules now and we know the basics. The rule of 6 is super simple to make it as easy as possible to follow.
Okay.
And that's what we've all got to do to try to get through this and get this back under control.
The fact of the matter is, Health Secretary, as you say, we all know the rules now. The rule of 6, the more simple way of saying what we need to do, fine. Yeah. People aren't doing it. We spoke to the Mayor of Liverpool today. He has said he wants national lockdown now because there needs to be a stop. We are seeing now what the virus understood to be doubling every 7 to 8 days, with more than 3,000 cases reported just yesterday. Now, when national lockdown came in, cases were doubling every 3 to 4 days. Yeah. Is that your tipping point? Is that where we need to get to before national lockdown is imposed?
Well, we are now taking more local action. We have far more tools that are...
Sorry, Health Secretary, I'm talking about the national level.
I know, and I'm answering it this way to say that we now have far more tools at our disposal to be able to make more targeted interventions, like the action that I took in the northeast yesterday, and we'll be making a further announcement later today in the normal way in terms of further local action. And that helps us to avoid a national lockdown. But a national lockdown is the last line of defence. It is, you know, as we saw in the spring, it is the thing that we can do to keep people safe if that's needed. So we're watching vigilantly, but we can see this number of cases accelerating, as you say, and we're prepared to do what it takes to both to protect lives and to protect livelihoods. And of course, both are so important.
How prepared are you to impose a national lockdown if these local measures, these regional measures, don't work? Because I'll go back to the Mayor of Liverpool, who's saying, look, it's all very well having these local restrictions. They aren't working. He's given so many examples of how concerned they are and concerned of the longer term effects of this. So what's the plan? National lockdown has to happen. Is the plan in place if it does?
Well, we don't have yet a local lockdown measures in Liverpool. And so the local lockdowns have been seen to be effective. We've seen that, for instance, in Luton. We saw it previously in Leicester, although the case rate is going up a bit in Leicester again. So the localised approach is more targeted, and that is our, that's the biggest tool that we're using at the moment. But the first line of defence, I describe a national lockdown as the last line of defence. The first line of defence is everybody doing their part. And Naga, I think the warning overnight is salutary. This is a moment again when the country needs to come together, and we need collectively to do what we all, every single one of us as citizens, needs to do.
I think you've made that message. You've made that message very clear, Health Secretary. I do kind of want to get to the nitty-gritty of this and get some clarity. If the last line of defence is national lockdown, absolute national lockdown that we saw, I think, March 23rd. What's the step before? Are there national lockdown plans, which is why I asked you, what plans are in place that perhaps aren't total lockdown, but effectively will mean everyone is under the same rules?
Well, if you think about it, the social distancing rules, they apply across the nation, the rule of 6.
Oh, look, but they're not working. This is why you've had to introduce more regional lockdowns. I'm talking about a national picture, because this is what's on the front pages of the papers. This is what we are hearing has been discussed by the government with this so-called circuit break.
Well, we want to avoid a national lockdown, but we're prepared to do it if we need to. So the way I've been trying to describe it, and it's really important for every single person watching this programme, is the hope that we have as a nation of avoiding a full-blown national lockdown is that everybody comes together and follows the rules that are in place now, the rule of 6 and then the local restrictions where they are, and the basics of hands, face and space. And then we don't rule out further action. Of course we can't, and we shouldn't. It would be wrong to. But what we do say is that we understand the seriousness of action like that, and we don't take any of these decisions lightly. But the big hope that we've got is if we can come together and all follow the existing rules and get this under control. But it is a very serious situation.
I'd like to hear what you've been told in terms of briefing by chief scientists. I mean, scientists have advised, they say, that there will be a loss of life. There is the potential of a loss of life if further interventions don't happen. You've described what further interventions you're prepared to put in at the moment with more announcements. When they say there is going to be further loss of life, what numbers have you been told? What death rates are we going to see? What numbers are we going to see?
Well, obviously we hope to avoid that. So
of course, but you've been given a scenario, haven't you, in order for you to act. So what have you been told? Well,
what I'd say is that we publish the information that we have on how the virus is spreading, and in fact the most significant of these and the best data source that we have is the Office for National Statistics survey, which is published on a Friday lunchtime. So everyone will see later today the best figures that we have in government. These are the figures that we make the decisions on.
No, sorry, those are retrospective. I'm asking you about what you've been told, what you've been warned about. You've had a meeting with chief scientists, and they've said to you, look, if further restrictions aren't put in place, we are looking at numbers like this. And that has obviously concerned you, rightly so. What have they told you? What have they told you to be worried about?
Well, there isn't a precise figure on it, because we all know these are uncertain times. I mean, that's the nature of a pandemic. The good news is that compared to last time, we now know far more about how clinically to treat coronavirus when people are seriously ill in a hospital. We've got we've got 2 drugs that we know work, thanks to the work of British scientists, dexamethasone and remdesivir, that help people who are in a serious condition in hospital. And we know far more about what we all need to do to prevent the spread and protect ourselves. So, for instance, this morning we're also publishing the winter plan for social care, and we've got far more understanding of the virus to be able to protect people in social care with the PPE, which obviously was a problem in the spring and is now massively more and better prepared on that front, and obviously the mass testing, the capacity for testing that we've got, which is huge compared to last time.
We will talk about testing. Let's do that. We had Dr. Higginson, who's consultant in emergency medicine, Vice President of the Royal College of Emergency Medicine, on the programme just a few minutes ago.
Yeah.
He has intimated that there are signs that crowding is coming back into emergency departments as it was before the pandemic. He says that hospitals are running at full capacity or high capacity, trying to treat patients with both emergency conditions and also the stuff that wasn't happening, these are his words, during the first wave of coronavirus. So when you talk about social care, can you now guarantee if hospitals are close to capacity and dealing with things other than coronavirus at the moment, and we're seeing an increase in the rate of infections, can you guarantee that now, as we saw at the start of lockdown and the start of the pandemic, that people won't be moved into care home settings without testing now?
Well, absolutely. That's one of the many things that we've learned is because of the asymptomatic transmission, and we have that testing capacity on a completely different scale from first time round, because we've built it and we've spent the summer building it. And on emergency care, I've been working very closely with the Royal College of Emergency Medicine to bring in the measures that we announced yesterday, which is money to expand A&Es so that they're physically bigger, but also rolling out the pilots of 111 first, so you can call 111 and they can help you get to the right care that you need, but also then let the emergency department know that you're coming, so you have an appointed time just to deal with these problems. So we are putting in place measures all of the time. The A&E measures I mentioned, I announced yesterday, with an extra £2.7 billion of cash for the NHS for the winter, and then the social care winter plan for today, and especially the infection control in social care to help protect people, because of course, as we well know, some of the most vulnerable to the disease are in social care.
I'd like a couple of questions on testing, if I may, while I have the time with you. You've spoken about ramping up testing. How are you going to make that happen?
Yes, so this is obviously critical, and we've all seen, especially this week, the challenges. We're on track to increase the capacity in testing to 500,000 a day from just over 250,000 now. We're doing that by getting more machines into the labs. We're installing those as we speak. We're hiring more people to run them, because it is a logistical exercise as well as the scientific part of it, just to get the samples into the right slots. We're automating that process, which is important. That's on the current technology. And then there's the much discussed next generation technologies, one of which DNA Nudge is in the news today, because it can do a rapid turnaround but relatively small volumes per unit. But the unit's only the size of a shoebox. You don't need a full-blown lab in order to do it. And we're backing loads of those new technologies.
By when? 500,000 by when?
500,000 by the end of October.
So if that rapid national testing system isn't in place by the end of October, national lockdown's inevitable, isn't it?
Well, the two are not as connected as that, because the most important thing for avoiding the national lockdown is that people abide by social distancing, and then if you have a positive test or the symptoms of coronavirus...
No, it's about whether you can get a test. It's not about the result, it's about whether you can get a test, because if that system isn't in place, this whole moonshot idea that was put forward by the Prime Minister, that system isn't in place by the end of October, we cannot work through coronavirus as it exists.
So there is not a link between the two. Testing, of course, helps, but the most important thing is that people follow the social distancing, and that if you get a test result, or you have symptoms, then you should self-isolate. And I think we've got to stress the importance of self-isolation as well as the social distancing, because it's that self-isolation that helps to break the transmission of the virus. And testing, of course, is a critical part of that, but it's very, very important that people follow the self-isolation. And if you've been a close contact of somebody who's tested positive, then you should not come forward for a test unless you yourself have symptoms, because you've got to self-isolate for 2 weeks, whatever the result of that test, because the virus incubates within us. So, of course the testing is important, but the first line of defence is people following the social distancing rules and self-isolating if that's what's necessary.
Matt Hancock, Health Secretary, thank you for your time with us this morning.
It's very good to have me on. Thank you very much.
See the headlines as they happen and watch BBC News live in the app and get the full story with bbc.co.uk/news. Follow the story for all the latest with BBC News.